A 91-year-old woman told her son that a nurse came into her room at night and gave her an injection she didn't ask for. She died the next morning. The hospital dismissed her concerns. That was 1993. He kept working for another 10 years, at 9 more hospitals, killing possibly up to 400 people. And if that number is accurate, Charles Cullen is the most prolific serial killer in American history. Not a gunman, not a monster in the dark. A nurse. Your nurse. This is True Crime Mysteries. The Shadow Lens. And this is what happens when the most trusted person in a room at 2 a.m. is the reason people don't make it to morning. Think about the last time someone you loved was in the hospital. Not a quick visit. Not a routine checkup. A real hospital stay. Overnight. Maybe you stayed as long as they'd let you. Maybe visiting hours ended, and you had to leave them there, lying in a bed, connected to machines, dependent on strangers. And you told yourself, they're in good hands. Because what else do you say? Now, imagine that the nurse who checked on them at 2 a.m. had already killed someone in that unit. And no one told you. Because no one told the hospital either. Because the hospital before that decided not to make the call. That is not a hypothetical. That is Charles Cullen. And the number of people who were in that exact position without knowing it may never be fully counted. Here's what made him different from every other killer in this series. He didn't need a weapon. He had something more powerful. Access. Nurses control medication. What you receive. When you receive it. What dose goes into your IV line. While you're asleep and can't feel a thing. Digoxin, a heart medication, can improve cardiac function at low doses. At high doses, it stops the heart entirely. Insulin drops blood sugar to fatal levels. Over hours, paralytic drugs leave a patient fully conscious, but physically unable to speak, move, or call for help. They can hear everything. They can feel everything. They just can't do anything about it. That was his toolkit, and it was already inside the hospital. And the most disturbing part, he wasn't hard to find. He was hiding in plain sight. As the nicest nurse on the floor. Charles Cullen was born in West Orange, New Jersey in 1960. Youngest of 8 children. Father died when he was 7 months old. Bullied through childhood. First suicide attempt at age 9. Drinking chemicals from a chemistry set. He tried to die. At 9 years old, he joined the Navy, served aboard a nuclear submarine, and then one day, a commanding officer found him at the missile controls, wearing a surgical gown and mask. No explanation was ever given. He was quietly reassigned. Quietly, that word is going to follow him everywhere in this story. He graduated nursing school in 1987. Charming, attentive, the kind of nurse patients asked for by name. And on June 11, 1988, less than a year after he started, he committed his first murder. Judge John W. Yengo SR, 72 years old, municipal court judge, admitted to St. Barnabas Medical Center in Livingston, New Jersey. Cullen injected him with lidocaine, stopped his heart, then went about the rest of his shift. He would later tell detectives that he lived most of his life in a fog, that he had blacked out the memories of murdering most of his victims, most of them, which means some He remembered clearly and chose to continue anyway. Michael Strenko was 21 years old. He went into the hospital for spleen surgery. Routine. Expected to go home. He never did. His mother later stood in a courtroom and said this about her son. He'd say, "I know what you need, Mom. Mom needs a hug. Now, instead of giving him presents, I get to put flowers on his grave." Michael Strenko was not a terminal patient. He was not suffering. He was 21. He was healing. And Charles Cullen decided that he was next. Here's what investigators found when they tried to build a profile of his victims. They couldn't. A judge, a 21-year-old recovering from spleen surgery, an 89-year-old war veteran, a priest, a woman recovering from breast cancer, a teenager. No pattern, no connection, no logic. He wasn't targeting people who reminded him of someone he hated. He wasn't settling scores. According to journalist Charles Cullen, the only reporter Cullen ever agreed to speak to, if the rest of his life was spinning out of control, he could poison patients. He could save patients. He had an arena in which he mattered. Control. That was the motive. When everything outside that hospital felt like chaos. Walking into an ICU and deciding who lived and who didn't made him feel like he was finally in charge of something. And here's the part that should make you put down whatever you're doing and pay attention. Because whenever a patient coded a medical emergency, Cullen was always the first one, rushing into the room, frantic, desperate to help. Of course he was. He'd caused it, and he already knew. There was no coming back from what he'd done. Between 1988 and 2003, Charles Cullen worked at St. Barnabas Medical Center, Warren Hospital, Hunterdon Medical Center, Morristown Memorial Hospital, Liberty Nursing and Rehabilitation, Lehigh Valley Hospital, Sacred Heart Hospital, Easton Hospital, St. Luke's Hospital, Somerset Medical Center. 10 facilities across New Jersey and Pennsylvania. 16 years. And at every single one of them, someone suspected something. At Warren Hospital, a 91-year-old patient told her son. A nurse came in at night and injected her. She died the next day. The hospital dismissed the complaint. At St. Barnabas, administrators investigated a rash of contaminated IV bags that likely killed dozens of patients. They quietly let Cullen resign without filing a single report with state authorities. And at Sacred Heart Hospital in Allentown, a nurse who had heard rumors about him at his previous job warned her coworkers privately. Not the hospital, not the state, privately, because that's how this system worked. Whispers instead of reports, quiet exits instead of accountability. And there was a specific reason. Hospitals chose silence over safety. Fear of lawsuits. Under the laws at the time, a hospital that gave a bad reference could be sued by the employee. So instead of warning other hospitals, they gave Cullen neutral references and sent him on his way. Clean record, new hospital, new patients, same outcomes. If this story is making you feel what we think it is, subscribe right now, because the next episode in this series is worse. A different hospital, a different state, the same broken protection of the people inside it. Hit subscribe so you don't miss it. In 2002, Charles Cullen took a job at Somerset Medical Center in Somerville, New Jersey, and on the night shift in the ICU, he met Amy Loughren. She was a single mother, 2 daughters, secretly battling a heart condition. She was hiding from her employer because if they found out, she'd lose her health insurance. She was holding everything together with both hands, and Charlie Cullen was the person who helped her do it. He covered her shifts. He made her laugh during the long nights when everything felt impossible. He was the only person who knew how sick she really was and never used it against her. We bonded right away, she later said, and became friends. Real friends, the kind you don't question. But then the patient started dying. The Reverend Florian Gall was 68 years old, a priest. He had been admitted to Somerset Medical. He was improving. Then suddenly, one morning, he crashed. Massive cardiac arrest. The autopsy showed Digoxin in his system. He had not been prescribed Digoxin. Someone had put it in his IV. Detectives Danny Baldwin and Tim Braun started pulling records. They found something that didn't make sense. A nurse had been accessing the medical charts of patients who were not under his care hours before they died. And that nurse's name kept appearing next to patient after patient after patient. Charles Cullen. The detectives went to Somerset Medical to look at their medication dispensing system, the Pyxis machine, which tracks every drug accessed by every staff member at every hour. What they found was enough, but not enough to make an arrest. Not yet. They needed someone on the inside, someone Cullen trusted completely. And there was only one person who fit that description. Detective Baldwin showed Amy Loughren what they had found, and she couldn't deny it anymore. She agreed to help. She wore a wire, and she went to lunch with her closest friend. When I told him I knew he had done those things, she later recalled, I watched him sit up. He changed into someone I didn't recognize. Cullen looked at her and said, I'm going to go down fighting. He was arrested that same day. Amy Loughren went back to the police station, still sick, still terrified, and sat across from him one more time to get a full confession. He murdered people right in front of me. She said, I literally risked everything to make sure he was behind bars. She later said it took her years to separate her friend Charlie from what her friend Charlie had done. I still wanted him to be okay emotionally, and I struggled with that for years. That is not weakness. That is the cost of trusting someone completely, and then finding out that trust was the weapon he used against every patient who trusted him the same way. Here's what makes Amy Loughren's story even harder to sit with. She was the last person to know. Multiple hospitals had suspected him for years. The hospital's own risk management specialist at one facility lied to investigators when they came asking questions, told them the medication dispensing records didn't exist. They did. A judge later called this the ultimate tyranny. Administrators deciding who would live and who would die, based on which hospitals they called to warn about Charles Cullen, and which ones they didn't. If you think people in your life should know this story exists, share this video right now. Not for views, Because the system that protected Charles Cullen for 16 years is the same system that still operates in hospitals across America. Sharing this is how it changes. Hit share. Charles Cullen was arrested on December 12, 2003. After 16 years, 9 hospitals, 1 nursing home. He didn't fight it. He made a deal. In exchange for avoiding the death penalty, he agreed to help investigators identify as many victims as he could. The problem was, he couldn't always remember who they were. I don't believe he ever had a specific recollection of somebody's name, said prosecutor John Forrest. He remembered a time frame, a diagnosis, a room number, but not a name. Because to him, they were not people. They were moments where he felt in control of something. He was convicted of 29 murders. He was sentenced to 11 consecutive life terms in New Jersey and 7 more in Pennsylvania. He will not be eligible for parole until the year 2403. He is 64 years old. He is still alive. At sentencing, the families were given a moment. Dolores Stasienko had lost her father, Jack Toto, an 89-year-old war veteran. She looked at Charles Cullen and said, "Burn in hell, Mr. Cullen, for all eternity." Michael Strenko's mother talked about the hugs her son used to give her. And then she said, "Now, instead of giving him presents, I get to put flowers on his grave." He called himself a mercy killer. He told investigators he was ending suffering, preventing the indignity of a traumatic code blue. Every nurse who ever worked with him said the same thing. When a patient coded, he was always the first one in the room, frantic, desperate, because he knew there was no reversal. There was nothing merciful about any of it. But here is the number that doesn't appear in his conviction. 400. That is the estimate of how many people Charles Cullen may have actually killed. Not 29. 400. Based on investigators' interviews, based on the gaps in the records from his early hospitals, many of which destroyed their documentation before anyone could examine it. Researcher Beatrice Yorker, professor of nursing, criminal justice, and criminalistics, has studied medical serial killers globally. She says that if Cullen's true count is anywhere close to 400, he is not just the most prolific killer in American history. He may be the most prolific the world has ever documented, and most of those victims will never be identified because their hospitals made sure the records didn't survive long enough to be read. After Cullen's conviction, New Jersey passed what became known as the Cullen Law. Hospitals were now required to report employee misconduct relating to patient safety. 37 other states followed. The laws exist now, but the question is, how many Cullens existed before 2003 that never got caught because those laws weren't in place? And how many exist today in the spaces those laws still don't cover because regulations close yesterday's door? They don't always know which window is open tomorrow. Years after the arrest, Amy Loughren reflected on what it had cost her, the friendship, the guilt, the years of struggling to forgive herself for not seeing it sooner. She visited him in prison dozens of times. She needed answers. She never got them. But she did get this. The only reason Charlie is not still murdering is because of my friendship with him. She showed up every day while fighting a heart condition that could have killed her. She showed up for her daughters. She showed up for her patients. She wore a wire against the person she considered her closest friend, because she understood that what was at stake was not their friendship. It was the next patient, and the one after that, and the one after that. There's one question left, the one that haunts this case more than any other. Why? He told a 60 Minutes interviewer he was a mercy killer, that he couldn't bear to watch patients suffer, that he was sparing them from the indignity of a traumatic code blue. The crash carts, the paddles, the desperate scramble to bring someone back. That's what he said. But here's what the record shows. His victims weren't always suffering. Some were recovering. Some were healing. Some were expected to go home that week. Michael Strenko was 21 years old. He was in for spleen surgery. There was no suffering to end. And every nurse who worked alongside Cullen said the same thing. Whenever a patient coded, he was always the first one in the room, frantic, desperate to help, because he already knew what had been put in that IV bag. Charles Cullen, the only journalist Cullen ever agreed to speak to, spent 6 years on this case. His conclusion: it was never about anybody but Charlie Cullen. He saw himself as a victim, and as a victim, he felt entitled to take it out on anyone within reach. Detective Tim Braun was more direct. He could save a life, or take a life, and in many cases, he chose to take a life. The motive wasn't mercy. It was control. Every failed marriage, every bankruptcy, every psychiatric admission, every time his outside life collapsed, the murders inside the hospital increased. Because in that building, at that hour, with that IV line in his hands, he was the one who decided. Nobody questioned him. Nobody stopped him. And that power over the most helpless people, in the most vulnerable moments of their lives, was the only place where Charles Cullen felt like he mattered. And this is how he did it. For 16 years, without getting caught, inside every hospital where he worked, there was a machine called the Pyxis MedStation, an automated drug dispensing cabinet. A nurse types in the patient's name, types in the drug. The drawer opens. The system logs the transaction. Secure, trackable, accountable. Except Cullen found the flaw. If you entered the order, then canceled it immediately, the drawer still opened, but the record showed a canceled request. No drug was logged as removed. He took the Digoxin. He took the insulin. He walked away. No trail. Later, when investigators started watching his Digoxin withdrawals, he adapted. He started ordering Tylenol instead, because Tylenol shared a physical drawer with Digoxin. He logged a request for a painkiller. He left with a heart medication that could stop someone's pulse. And it worked for years, until Amy Loughren sat down with the Pyxis records and realized what she was looking at. There were so many withdrawals of lethal medications. She later said, no reason except if you want to kill someone. But here's what you also need to know. When investigators went to Somerset Medical and asked for those Pyxis records, the hospital told them the machine only stored 30 days of data. The investigators went directly to the machine's manufacturer. The records existed, years of them. The hospital had lied. On March 2, 2006, Charles Cullen was brought into a New Jersey courtroom. For sentencing, he wore a bulletproof vest under his sweater. 15 feet away, the families of his victims stood one by one at a lectern and said everything they had needed to say. For years, they called him vermin. They called him garbage. They called him a monster. You betrayed the ancient foundations of the healing professions, the judge said. Cullen sat motionless, eyes closed. When asked if he had anything to say, anything at all, he said, nothing. Not one word of explanation. Not one word of apology. Just nothing. John Shanaker, whose father was murdered, said his family will never feel safe in a hospital again. Mary Strenko, whose 21-year-old son Michael had gone in for routine surgery, stood up and talked about the hugs her son used to give her. Now, she said, instead of giving him presents, I get to put flowers on his grave. And during all of it, all the tears, all the grief, all the rage directed at him, from 15 feet away, Charles Cullen kept his eyes closed. He had refused to attend the sentencing at all, unless the court approved one thing: his request to donate a kidney to the son of his ex-girlfriend's relative, a man named Ernie Peckham, who was dying of kidney failure. He held the sentencing hostage. The families of his victims, the only people who would ever have the chance to look him in the eye in a courtroom, were bargaining chips. The donation was approved. He showed up. He said nothing. He kept his eyes closed. The kidney was removed in prison in August 2006 and flown to Stony Brook University Hospital on Long Island. Ernie Peckham survived. His mother never told him where the kidney came from. Before we close, the number that belongs in every headline about this case and almost never appears: 10 facilities. Not one, not 3, 10. St. Barnabas Medical Center, Warren Hospital, Hunterdon Medical Center, Morristown Memorial Hospital, Liberty Nursing and Rehabilitation Center, Lehigh Valley Hospital, Sacred Heart Hospital, Easton Hospital, St. Luke's Hospital, Somerset Medical Center. 9 hospitals and 1 nursing home. Across 2 states. Over 16 years. At every one of them, someone noticed something. At every one of them, a decision was made. And the decision was almost always the same. Let him resign. Don't file a report. Don't make the call. Don't put it in writing. Because writing it down meant they had known. And knowing meant liability. 20 lawsuits were filed against the facilities where he worked. Most were settled confidentially. The records sealed. The numbers hidden. 29 confirmed murders. Possibly 400. The difference between those 2 numbers is the space created by 10 facilities that chose their own protection over the lives of the people in their beds. Charles Cullen is in New Jersey State Prison. He is 64 years old. His earliest possible parole date is the year 2388. He will die in that cell. He was convicted of 29 murders. He told investigators he killed as many as 40. Researchers believe the true number may be close to 400. If they are right, he is not just the deadliest healthcare serial killer in American history. He may be the most prolific serial killer the world has ever documented, and most of those 400 potential victims will never be officially confirmed because many of the hospitals destroyed their records before anyone could examine them, because most of the deaths were logged as natural causes by the same institutions that employed the man who caused them, because his nursing license remained valid and active for 16 years without a single formal complaint ever being filed against it. He killed his first patient in 1988. He was arrested in 2003. 15 years. The families of those potential 400 are still out there, sitting with questions that have no answers, visiting graves marked with causes of death that were written down quickly by people who didn't look too hard. There isn't closure for the families. One relative said at sentencing, "You just have to deal with it." And that is the most honest thing said in any courtroom about this case. There is no closure. There is only what happened, what was allowed to happen, what is still right now. In some building you have driven past, allowed to keep happening, because systems don't change by themselves. They change when enough people know the truth and refuse to let it stay quiet. That's why this story exists. That's why you're still here.